I saw your press. Good.
So, good morning, Costa Rica. I am very thankful to these technological devices that allow me to be here with you. Although I was going to be there with you in person, I had a personal last minute problem with some court issues, so I could not fly to Costa Rica. My name is Ana Moreira. I am a medical doctor. I work in the integrative medicine, functional regenerative medicine since about 18 years. I am the president of the Portuguese Society of Integrative and Regenerative Medicine and also the president of the Portuguese Society of Ozone Therapy. Besides that, we, as a medical society, organize international medical congresses. And last year, we had the sixth international integrative regenerative medical congress in Porto, in Portugal, where our Porto wine has got its name from. So I think that you all know Porto for that. And we had 1,800 people, and it was a very big congress. And maybe the organizers of the Costa Rica retreat can say to you that you are all invited to come this year in December. So I was going there to talk you about regenerative medicine. I work in that field particular since about 4 to 5 years. We do IV infusion of stem cells here in Porto in the clinic. We also do exosomes infusion, and we organize longevity retreats a little bit, especially in Portugal, but also we are expanded to like Costa Rica and other countries like Brazil that allow people to go, and more to patients actually. So we take patients with us, and we do infusions, ozone, exosomes, whatever they need. So that's what I'm going to talk you today about, how we are overloaded with these toxic toxins, and why we are becoming why we are aging older, and why we are aging with more diseases and more chronic diseases. So let me share you my presentation. I will gladly send the presentation to Grace, and if you want to read it after my presentation. So let's talk about this this regenerative integrative medicine. It's a medical field of health. It started about 70 years ago in the United States. It's well established in Germany, Switzerland, and Portugal and Spain are a little bit behind, but we have a good organization here, and we do a lot of workshops and seminars to try to more doctors can study it. This is my email, my personal email. If you have any question after this lecture that you want to ask me about, please feel free to send me an email, or you can scan the QR code and you will get all my social media. Also, I've written a book in Portuguese, unfortunately not in English yet, How Not to Get Ill. The idea is a book to people, telling them a little bit of diet, of good, healthy circadian rhythms with sleep and microbiome, and also a little bit of emotional relationships. Okay. I am not paid by any company to do this presentation, so this allows me to talk to you about my practical experience in my clinic. So we have a saying here that we are sure that humanity is moving towards extinction of our race, because my great grandmother had 12 children, my grandmother 9, my mother had 2 children, I have 1 child, my son will have a cat, and the cat will be castrated. So actually we are aging, and we are aging. We have more old people now that we used to have. This it's a political problem because of retirement funds, and so it's expected then in 2050 more than the percentage, the projection of the estimate people above 80%, above 80 years, sorry, will be around 20%. So what is aging? Aging in medical terms is characterized by a progressive loss of physiological integrity, leading to impaired functional and increased vulnerability to death. So this deterioration is the primary risk factor for major human pathologies, including cancer, diabetes, cardiovascular disorders, and neurodegenerative diseases. So this process of aging, it's more or less equal to loss of integrity. That means we are in bad aging. So we age in bad manners, let us say like this. So aging, according to this study of 2019, is best defined by damage rather than mortality. And by this manner, we know that aging starts very early in life. So as you see in the picture above, we grow because we have a selection against alleles that are deleterious. And then as we go old, we accumulate genetic damage and epigenetic damage. So if we don't, if we go through the early life selection by like an abortion, for instance, or a premature child death, we accumulate this damage, and this is what we call the bad aging. So we don't age in good manners. And this going up in the longevity, so we will get older, but we are getting sicker. So we get older and sicker. And we know that the chronic non-infectious disease like heart disease, stroke, cancer, or diabetes correspond to about 75% of all deaths globally. And we also know that the 4 major, corresponding to 80% of all deaths, corresponds to these 4 chronic diseases like cardiovascular, diabetes, cancer, and respiratory diseases. And this article from 2020, it's very interesting because it put us in the basis of this, like a risk factor, the diet, tobacco, physical inactivity, and alcohol. So we know that this is associated with some modifiable risk factors. And how does this cost us as humanity? How much money does this cost? From American statistics, we know that health expenditure is higher in United States, that more it's the most higher expenditure in all over the world. But it's very interesting because the life expectancy is not corresponded to the money they spend in health. So they are the ones that spend the majority of money, like you see here in this graphic, from all over the world, but the life expectancy is higher in Japan, in Portugal, in Italy, in France, in Germany, than in the United States. Why is this? Because the medicine as we know it today, we are doing a lot of high risks, high costs of medical interventions. So, for instance, we know that a cardiac stent is a very very high cost treatment, versus if we would do promotion of health with lifestyle changes that allow people to lose weight, don't smoke, do exercise, and sleep better, the statistics prove us that there is a very lower cost, not a treatment, but intervention would be an early also intervention. So this is where the functional medicine as we know it, this is where we can make an intervention to our patients. And so when we talk about regenerative medicine and longevity, and you are there in Costa Rica to learn a little bit of regenerative medicine, but also to go and have a good sea bath and to eat in a good proper way and to catch some sun, to get some vitamin D. And so this was one of the ladies that we saw in our last retreat, this old lady, and we were so amazed with this old lady, and so we went to talk to her, and she was so good looking and so old, and we say, what is your secret? I mean, I see that you are smoking. What are you doing? Why are you so fantastic? And she told us, oh, I smoke 4 packs of cigarettes a day. I drink like a bottle of wine every day. I only eat junk food, not that shit anti-inflammatory diet that you do, and I don't exercise. And we were, okay, so you are the one that the statistic doesn't catch. This is amazing. You are so good. So how old are you? Can you tell us? And she told us, I'm 30. So this is a little bit of a joke to introduce us to these hallmarks of aging. We know today in our scientific books and our scientific articles that aging is a process, and we have these primary hallmarks of aging, like the genomic instability that you see here in the blue figure, the telomerase attrition, so they get shorter, these epigenetic alterations, like the lady before. So she was smoking and didn't eat well. So she did a premature aging because of these epigenetic alterations. Also the loss of proteostasis and disable macroautophagy. This is very important. And then we have some another hallmarks like the mitochondrial dysfunction. This is mitochondriopathy. It's very important that you can study can study the mitochondria, and also the cellular senescence. And in integrative vision of aging, we have the gut dysbiosis with leaky gut. We have the chronic silent inflammation. We have the altered intercellular communication with the loss of exosomes, vesicles, and we have something very important called the stem cell exhaustion. So we need to introduce a new name called inflammaging. So this inflammaging describes the silent chronic inflammation process that it's not activated like the autoimmune system or the adaptive system, but it feeds itself due to the depletion of the immune system that causes chronic production of these pro-inflammatory cytokines, of course, due to incorrect behaviors and incorrect lifestyle habits. So we know that when we talk about inflammaging, we know that we have increase in inflammatory cytokines. We have an increase in senescent cells. These are old cells. We have an increase in dysfunction of the mitochondria, and we have a decrease in the autophagy and the proteosomic activity. So we go from this bad aging, from this inflammaging, where we age, but we have age-related diseases, and we go to this anti-inflammaging, where we do a remodeling and immune adaptation of our immune system so that we can have longevity. And we do this by diminishing the antigenic load and the anti-inflammatory mediators, and of course doing some lifestyle changes. So to explain in another manners, this chronic inflammation during aging occurs as a consequence of these multiple derangements that came from the other hallmarks of aging. So this is another figure of the same subject where we accumulate damage through our life. Of course, some come from the environment. These are called the epigenetic damages, and some come from our genetics that we know today that also came from the environment. And this is very important because this is the base of some technique we use like ozone and therapeutic apheresis. This decrease autophagy that occurs as we age, it's a critical element in terms of a therapeutical point of view, because as we decrease autophagy, we accumulate pro-inflammatory proteins and dysfunctional organelles. And this leads to a response a pro-inflammatory response from our immune system to try to cleanse our extracellular matrix of these abnormal pro-inflammatory proteins. And this chronic low-grade systemic inflammation that tries to cleanse this extracellular matrix, it's called, what we call connective tissue, where we have these proteins and organelles in a dysfunctional point of view. So it maintains us in a pro-inflammatory response. This is another article from 2018 showing that this bad aging can come from the diet, from, of course, since our mother. We know today that the things that our fathers did 6 months before our conception, before us being conceived, counts as epigenetic alteration in terms of what we are going to, in diseases that we are going to have later in life. And since our conception until 2 years old, everything that our mother does, the way that we are fed, the delivery from C-section or vaginal delivery, everything counts in terms of accumulating for our health or disease. And when we think, and when we know these theoretical aspects of aging, we know that we can prevent and correct this bad aging. This is what we call longevity medicine or regenerative medicine, where we can do lower cost medical treatments, lower risk medical treatments, and of course, early medical treatments. And these early interventions should begin when we see a patient that wants to have a baby. So we could act in the prenatal stage, where we could help the mothers, for instance, in the gut dysbiosis, and that would help stress management techniques. Also help the mother delivering the baby in a more natural way. And then we can help the baby until 2 years old by giving a good anti-inflammatory diet, by helping with the gut axis, and by trying not to give them antibiotics. That would prevent that later in life we would have chronic diseases. And this later in life that we talk about also comes from one very important thing. So we have already know that the accumulation of inflammatory proteins and dysfunctional organelles is a cause of chronic silent inflammation that takes us to aging. But also the mesenchymal stem cells that we know that could keep us young are going to diminish with age. So here you can see a slide that shows that a newborn has 1 mesenchymal stem cell per 10,000 marrow cells. And then later in life, at age of 50, for instance, 1 mesenchymal stem cell to 400 marrow cells. So we have this stem cell exhaustion, and also not only by aging. It's not the sum of age, the numbers of birthdays that counts. What counts is that we accumulate these toxic metabolites, and we accumulate chronic inflammation, we accumulate these poor immune system that lead us to this stem cell exhaustion that make mitochondrial damage and stem cell depletion that will take to bad aging. So, how can regenerative medicine helps in longevity promotion? So first, you remember the graphic, we can make lifestyle changes. So we can teach our patients to eat better, not to eat at all, with fasting and caloric restriction, with orthomolecular supplementation, with physical exercise, with an adequate circadian rhythm. So we can teach our patients to go early to bed. Also very important is the stress management techniques. We know that the something called burnout is a disease and can lead us to bad aging and microbiome regulation. So this is a very short how can I say, very short, in a very short manner, that I resume some lifestyle changes that we work in integrative medicine, and that you can be, that you can talk with your patients so that they know that this is a very almost free intervention that gives them a great outcome. Then we will talk about medical interventions. These interventions we need a clinic to do, like hyperbaric ozone, like intravenous infusions, like the apheresis, like the infusion of stem cell and infusion of exosomes. Okay, so what about lifestyle changes? We have a lot of articles today that show us that the lifestyle modifications and also the pharmacological interventions are good strategies to help bad aging and cellular senescence. So, for instance, here you can see that optimizing your lifestyle with one optimized diet, anti-inflammatory diet, especially with water, vegetables, fruit, some fish. In Portugal, it's very easy to cut wild fish and also good meat. But you know that some patients are vegetarian, and it's okay if they supplement, and especially if they buy free pesticides vegetables and fruits. So diet. Also, caloric restriction is very important. What we call fasting, and well, it's not the same as fasting, but caloric restriction comes with helping our patient to do intermittent fasting, physical exercise, and then of course no smoking, trying to diminish the pollution that we have, antioxidants. This is the orthomolecular supplementation that we talk about. Also a good sleep, and we know that this diminishes the mitochondrial dysfunction, diminishes the oxidative stress, helping in our cellular senescence. So the first one would be the caloric restriction. Also, as I told you, intermittent fasting. This is very important. And we have a lot of articles. I just brought you one. This is an article from 2018 talking about the micromanagement of nutrients and the healthy aging. Also, the orthomolecular supplementation, like for instance the flavonoids and the other non-flavonoids like the curcumin, resveratrol, and the quercetin, vitamin B, vitamin D, antioxidants like vitamin C, and magnesium. Also, we need to take some time of our appointments to talk to our patients about their sleep. If we help our patients to improve their sleep, they will improve their cognitive ability, they will improve their blood pressure, they will improve their liver function, and with time that will decrease risk of chronic disease. About stress, we know that what we call stress today, it's a risk factor of the majority of chronic diseases. The psychosomatics tell us about the demands that we are living in our outside world and how we feel in our inside world, the emotional body, let us say like this. But this article was very interesting because it talked about the psychological stress and the rate of aging. So what we know today is the amount of psychological stress, the demanding stress, and the cumulative psychological stress can accelerate the epigenetic aging. And this is very interesting because it reduces the cognitive ability that we have. So the stress response influences multiple biological aging pathways like the adrenal gland activation, causing cellular senescence and bad aging. So we need to teach our patients stress management techniques. And what about the microbiome, the gut? What about the leaky gut? So we know that the microbiome has a very direct impact in aging. And the way that the dysbiosis, the gut dysbiosis, influences the senescent cell accumulation is a direct way. So we know today that the decreased bacterial diversity, like the bifidobacteria and fecalium bacteria, allows the gut to be leaky gut. So we have hyperpermeability, and this disrupted barrier allows more chronic inflammation, allows an aging phenotype with chronic diseases, inflammation, and immune dysfunction. So this is very important, and this is we cannot accept our colleagues to tell us that this is not scientifically proven. This is a 2022 study talking about the role of probiotics, of starch, and resistant protein to promote healthy aging. So we need to show this to our patients, telling them what they eat influences the gut, what they should do, like the rectal ozone insufflation, glutamine to leaky gut, butyrate to leaky gut, probiotics, and also physical exercise. And about medical interventions. So these are interventions that we do in medical clinics, like the ones that I show here. This is the same study about the hallmarks of aging in another aspect of hallmarks of aging. So we can start for ozone. Ozone helps as an as a inflammatory modulation therapy, also helps with mitophagia and mitohormetics. And we know today that ozone therapy helps in telomerase reactivation. So hyperbaric oxygen ozone therapies in healthy aging and longevity, it's a well-proven technique, as you can see here with stem cell therapies and therapeutic apheresis. So stem cell stimulation, especially the 10 pass, the 20 pass hyperbaric ozone therapy, helps improve the angiogenesis for helping with interleukin-1 and VHG factor. Helps with inflammation, so the ozone diminish the interleukin-2, interleukin-6 and helps improve interleukin-4 and 10. So help us with modulating the inflammation. Also very important is the suppression of cellular senescence. The ozone, hyperbaric ozone, helps us with telomerase elongation, and also in the antioxidant activity. To resume, the ozone can help us with cognitive improvement, also with cardiovascular improvement, in photoaging of the skin, inhibition of bone loss, very important in menopausal women with osteopenia, also inhibition of muscle loss, especially with men that have low testosterone and with glucose metabolism. Okay, what about intravenous infusions? What are the infusions that we can do in an anti-aging regenerative point of view? We can help our patients if we inject them NAD, for instance, nicotinamide riboside. This is an article from 2016, June 2016, that tell us that NAD repletion improves mitochondrial and stem cell function. This is a mice article, but we know that treatment with NAD induces the mitochondrial response and so rejuvenated muscle stem cell senescence. What about NAD plus? Also IV stimulates a group of anti-aging genes called the sirtuin genes. They are in a lot of studies today, which they are the ones that control one of the most important pathways of aging. Also, they are involved in DNA repair, and they increase the efficiency of stem cells because they help providing more ATP. So NAD can help us with genome protection, neuroprotection, insulin sensitivity, sirtuin activation, and improve stress resistance. So if we have a patient that wants to get in a longevity program and has a chronic disease like obesity, like diabetes 2, like cardiovascular disease, that are the majority of our patients, we can put them in a NAD plus IV infusion therapy. So NAD plus is being comment as a vital cofactor that can rewire metabolism, activate sirtuins, and maintain mitochondrial fitness. Q10, so there are a lot of articles talking about coenzyme Q10 and aging. So it helps us with antioxidant effects. It helps us in the mitochondrial electron transport chain. It helps us in modulating gene expression and maintenance of pH, especially in pH of the lysosomes, and supports cellular antioxidant capacity. Also, vitamin C, IV vitamin C is a good mechanism of an anti-aging procedure, especially in the immune system. So we know today that the CD4, CD8 cell thymic atrophy is treated with IV vitamin C infusions. This is what we call free radical theory of aging. Also, resveratrol, this is an article from 2021. So resveratrol has tremendous potential in the prevention of aging and aging-related diseases like cardiovascular, diabetes, osteoporosis diseases. Especially because the resveratrol helps activates the sirtuin 1 and activates the RNF2 like the ozone therapy, so it suppresses oxidative stress and helps with mitochondrial function. What about amino acids? IV amino acids like the arginines, especially arginine shows a great promising as a nutritional agent, especially in a cognitive factor. L-carnitine, we use it to when we do mesenchymal stem cell procedures, so especially in regenerative medicine. Also, another technique that we do is the therapeutical nanomembrane apheresis. So I will recall you this slide that I have already shown, that with aging, we decrease the autophagy. So we accumulate in the extracellular matrix proteins and dysfunctional organelles. These maintain a pro-inflammatory response, and these systemic proteins are pro-aging. So this aging that leads to a decrease in autophagy leads to this pro-aging response. And this apheresis, this therapeutical apheresis technique, help us with the clearance of senescent cells from the tissues and elimination of damaged cell. So this is an article showing the difference between nanomembrane based therapeutical apheresis and other plasmapheresis devices. This is an article from 2021 showing exactly why can we use the therapeutical apheresis as a longevity treatment, because by cleansing these progerontological factors help us improve the extracellular matrix, making it younger because it doesn't have these dysfunctional organelles and these inflammatory proteins. So in reality, what we are doing is removing toxicity from the extracellular matrix. You all know that this occurs extracorporeal through a filter, and it's independent of the kidney and of the liver. And some articles, literature revision. So this is an article from 2023 that talking about therapeutical apheresis that should be an intriguing and high potential therapy in several specialities, especially anti-aging. This is an article from 2015 talking about therapeutic aphoresis as a very important tool in the future. And also this article that comes from 2010 talking about aging process that could be prevented by therapeutical aphoresis, because exactly removes these pathological molecules that accumulate in the aging process. These are some molecules that the therapeutic aphoresis can filter from our tissues, like adhesives, antibiotics, botulinum toxin, bactericides, chemical, chemotherapeuticals, medication, detergents like the sodium lauryl sulfate that we use in the shampoos, food ingredient like aspergillus, fungicides, herbicides, insecticides, metals, especially, of course, heavy metals that are carcinogenic, like mercury, lead, arsenicum, aluminium, microplastics. This is not it's not the issue to today's lecture, but we have a good literature revision in microplastics and chronic diseases. We humanity are eating the correspondence to one credit card, about 7 grams of microplastic per week. And so this article shows that the microplastics are removed by the therapeutic aphoresis and tooth materials and vaccine ingredients. To finish, intravenous infusion of mesenchymal stem cell. These are the stem cell-based therapies. We know that we have the perinatal sources of mesenchymal stem cell and the adult sources like the bone marrow and the adipose tissue, also the dental pulp. We use the dental pulp also in Porto, and the bone marrow and sometimes the adipose tissue. We know that the mesenchymal stem cells have tropism to inflammatory tissues like age tissues, so they can exert its therapeutic effect in a direct way. We can regenerate or replace some things in our body with stem cell, and they are of majority of therapeutical applications, but especially we are talking about in reversing or delaying aging. So we know today that stem cell therapies have broad application in the field of regenerative medicine. So it represents a new and good strategy for treatment of aging-related diseases, also what we include as this bad aging. Remember, aging with diseases is what we call bad aging, because we can age without any disease. This is the flow chamber that we use in Porto. Also, we use intravenous infusion of exosomes. It's also a stem cell-based therapy, and these stem cell-derived exosomes allow the proliferation of, for example, these fibroblasts, and inhibit the production of oxidative stress, thus alleviating the senescence. So this article from 2024 show that the exosomes can reverse the age-related diseases by stimulating the PGC1 expression, allowing mitochondrial metabolism, so they allow mitochondria to rejuvenate. This is a new proposed hallmark of aging. This is very new, 2023, 2024. So they can be used in aging, these extracellular vesicles, exosomes, because exactly they reduce aging marker, they increase anti-aging effects, so they have anti-aging potential. And as last, I cannot close this lecture by talking in the functional dentistry. So we have a good department of functional dentistry in Porto, especially because in Portugal, the amalgam fillings was something very used in the past. So people have a lot of heavy metals in their connective tissue, and this has cardiovascular toxicity, hepatotoxicity, neurotoxicity, and of course, immunological toxicity besides cancer. This is one of the tests we use when we are seeing a patient for regenerative medicine, especially to the dentistry part. We never treat a patient without seeing the teeth. And this RANTS test is CCL5 chemokine determination. That is a blood test, is shown in the blood. It's a signaling molecule that attracts immune cells to the inflammation site. So we know that this silent inflammation that occurs in deaf endodontic treated teeth, it's very important, because if it's high in blood and the CRP protein, the C-reactive protein is normal in blood, show us that this has a sensitivity to the jawbone. And there are a lot of articles showing the RANTS positive and the jawbone inflammation. So never forget to see your patient teeth. Although you don't work with any integrative dentist, you should do a dental examination if you want to see a patient in a holistic integrative functional way, but also if you are seeing a patient in an integrative regenerative potential longevity point of view. So we need to be, as medical doctors, we also need to be neurofocal dentists. This is very important because we need to do neurotherapy also in the mouth. And to finish, we also do the stem cell therapy in the gums, in the tissue of the mouth. And we have a lot of patients that did not lose their teeth because they could renew the bone, the jawbone, and also the gum. 56 minutes. I am very German in my time. So this is my phone number, this is my email, this is my website, and it was a pleasure being with you today, although at distance.